Okay, so let's go ahead and get started talking about these cognitive demands and the how to objectively document them. So I guess I didn't introduce myself yet. My name is Jen McGillis. I'm one of the owners here at Ergonomics, and Chris, who is online with us today, is our staff member. All of us practice the full gamut of office ergonomic assessments, cognitive assessments, physical demands assessments, non-office ergonomic assessments, and can help you out with ultimately whatever you may need. So at Pro Ergonomics, our mission statement, our goal is to always provide our clients with professional, proactive, and productive solutions to your ergonomic strategies. Ultimately, every organization probably has some ergonomic goal or project or task going on just about at any given time, whether it's in your office environment or in a more industrial type space, whether it has to do with physical or cognitive demands assessments, which are more about return to work. Most of our companies we're working with are doing something associated with ergonomics, and we provide some ongoing support because we know that you're busy and that you wear 15 or 30 some days different hats, and so we help to take some of the pressure off. So when you have a big project on the go and you need it done in a timeline that is reasonable, oftentimes you need help, and that's where we get involved to provide you with that high quality, quick turnaround end results so that you get the product that you need in the timeline that you need it. So the plan for today is to talk briefly about what are cognitive demands. I don't want to go into great detail in this, but I think we just need to all be on the same page. So this part will sound very similar if you joined us for our Lost Cognitive Demands webinar. We're going to talk about the impact of cognitive issues on the workplace briefly because we are seeing a significant increase in these demands. So we want to make sure that we're talking about how that's impacting our workplaces or why it's important. Then we're going to move on to cognitive demands at work, and then most specifically about that objectively quantifying those demands. How do we do that so that we can say that this occurs with X frequency or with X complexity? How do we actually evaluate that? And then how does those quantifying demands play a role in the return to work and the accommodation piece? So first off, cognitive demands are really about, well, cognitive, ultimately the term cognitive is derived from the term cognition, which really means understanding. So this is a person's ability to acquire knowledge and understanding, in this example, in their job, right? So that they are able to draw in the appropriate information from multiple sites, pull that all together, and make appropriate decisions and planning and strategies and ask the right questions because they're gathering the right information. So these are things like people gather social cues, right? Many of us know, right, if we have no cognitive limitations in this area, we know when someone is checking out of a conversation, for example, right? They stop looking at you directly, their nonverbals change, perhaps they start, they just get distracted. They're on their phone or they're taking some notes or something that seems unrelated to the conversation. We catch those social cues, right? I understand that that means that I have reached the point of their listening, right? They are done listening to me. They've gotten the content that they need and they're moving on. So if I have more information that is important, I need to figure out a new way to catch their attention. And if I think that that's sufficient enough and we can move on, then that's the time to let go. Not everyone gathers all those social cues the same way. In fact, I would say many people gather them differently, but there are some people who don't really gather them at all, right? They don't understand those social cues that are saying to someone that they've got the information that they need. So that person may not know when to stop. They may not know that they need to provide more information on the flip side, right? What if your management team doesn't catch that social cue that your employee hasn't gotten it yet, right? They don't see the lack of understanding on their face. They don't understand, can't draw that information in and build the picture that the employee has got it and it's time to move on, or the employee has not gotten it or not understood it and they need additional help, right? So there's all kinds of social cues that we draw in. Your body language plays a huge role in that, right? What you say plays a huge role in that. And we all hear things differently. So the verbal communication is incredibly important as well. So we have to pull all this very complex information together to build an understanding of the task or the job or whatever it is that we're being asked to do. And so ultimately, all of those things working together makes us successful at that. But if we're struggling in one or many of those areas, we may see some limitations in our ability to pull that information together, which poses significant limitations on how we're able to do our job successfully. Right? So we need to talk about how we can help these people be successful. Pardon me. So cognitive limitations occur for a whole host of different reasons. It might be that someone's had an injury or an accident of some kind. For example, a simple one that we've heard a lot about lately is somebody has a concussion. And I say simple in terms of it's common, but it's certainly not simple in terms of the types of experiences people have as a result of that. Their symptoms, their ongoing issues, right? There's some people will have problems with vision, with memory, with focus and attention. They have all kinds of different limitations associated with that. But that's an injury, right? That they had a sporting injury or there was some sort of accident that's caused a concussion, and now it is creating some other limitations for them. It can be a medical issue. It doesn't have to be something that was traumatic, right? It can be a medical issue. It might also be a learning disability of some kind. So somebody has a cognitive limitation, how they gather and obtain and process information from a learning disability. There's all kinds of different cognitive issues that might be present that can lead to, ultimately lead to some of these cognitive limitations that you may have to be accommodating as an employer. I've given you some examples there, but by no means are they an exhaustive list, right? They are just some of the types of things that people might go through which could create cognitive limitations. What's probably the most interesting is that there's been a fair bit of research that indicates that people's cognitive limitations present in different ways depending on where they are, right? And so your level of comfort and the level of challenge that you're being presented with sometimes impacts how your cognitive limitation comes out or is demonstrated. So there is some research that's suggesting that mental health disorders or cognitive limitations may be quite different at work than they are in other situations. So just because someone can, let's think, so someone in their home environment is able to create a grocery list and a meal plan for the week, right? So they've got a strategy for how they're going to cook for the week, right? That they have some limitations in terms of organizational skills and whatnot, but they've got a system in place. They document what they're going to eat every day for the week. Then they create their grocery lists associated with that. Then they're able to successfully go grocery shopping and come home with the right items, right? Just because they can do that at home doesn't mean that they're going to have the same ability to process and plan at work in the same way. So at work, they may be faced with a similar task. They may be asked to plan out, well, think about your jobs perhaps. You're asked to plan out a wellness week, right? It has a similar concept to it. You need to plan an activity for every day. Then you need to gather all the materials you need for each activity that's occurring or gather all the resources, right? It's a similar process. Plan for a week, create a list of things that you need, right? And then go out and acquire those things. And although it's a similar process, because it's at work in a higher stress environment, perhaps with more on the line, ultimately, people are going to respond very differently. So someone who's able to problem solve through that situation at home may not be able to do the same at work, which is one of the challenges associated with cognitive limitations is we can't, even the documentation of what someone can do may, although we say they can do this, it may be slightly different when they actually have to do it in a work environment where there's more stress, more time pressure, more deadlines. It may change what their abilities are, which is one of the significant challenges of us trying to return people to work with cognitive limitations. Now, we know that the financial impact of physical and mental health problems in the workplace is fairly significant. One study that was done relatively recently looked at the different costs, like the actual financial element of this in the workplace, and it identified the top 5 most costly health conditions. These are listed in order, and I've bolded 4 of the 5 because out of the top 5, 4 of them are directly related to cognitive abilities. Someone who has depression or has pain, arthritis, anxiety, right? Depression and anxiety definitely obviously directly related to cognitive limitations. Arthritis and pain in the back and the neck are more physical related, but can easily be connected to a cognitive limitation as well. As people struggle to be able to do tasks they once could, there may become some barriers that they create cognitively as well. So 4 of the 5 of the top items there are directly related to the physical and mental health of employees in our workplace. So we definitely need to be addressing these and not forgetting that I guess my message is that we do generally, I think, a pretty good job of addressing the physical demands. There's been a pretty good structure and strategy in place for the last, many years, as long as I've been working in this industry, there's been a pretty good structure in place as to how we deal with physical limitations, right? We develop a document that describes what the physical requirements of the job are. Then we take that document and compare it to what the physical limitations the doctor is giving us, figure out if the employee can go back to work or not, is there a match, and then we're able to move on from there, either providing accommodation or alternative work or bringing them back to their regular job. And now we have this whole new avenue, right, to explore with this idea of cognitive limitations. How do we address these cognitive limitations really effectively? Right, so now the problem is that we're just starting to work on developing a new structure or system so that we can understand how we address these. So things like depression and anxiety, everybody has different responses to that. So mentally or cognitively, they're going to have different abilities depending on the duration and the severity of their depression or their anxiety levels, for example. They're going to be able to work in certain situations and challenged in others, right? And how do we take that information and take the information about our job and accurately compare the two, right? We've been able to do that from a physical perspective, but we're just learning to do that from a cognitive perspective, at least to do that objectively, right? Because right now I think a lot of companies are still stumbling through this if they're faced with any kind of cognitive limitation. So studies have found that even further to the top 5 list that I just gave you, that indirect costs, which in particular is focused on lost productivity, which makes sense based on the types of jobs or tasks we're referring to, of mental health disorder, exceeds companies' spending on the direct costs. And this is consistent with much of the messages we've heard in the past several years about direct versus indirect costs for mostly all claims, right? That indirect costs, things like lost productivity and the time that you might put into returning this person to work, right? All of these elements are going to be more expensive than the direct cost, which is actually having that employee off work and paying their salary where they're not present, for example, right? That the actual indirect costs, all the other soft costs, are actually quite a bit more expensive. So being able to accommodate people effectively is really the ideal, right? If we can accommodate someone and get them back so that they're working as productively as possible, then I hopefully am minimizing those lost productivity and other indirect cost issues. This research study also found that companies should be spending more money on mental health to help their staff. Ultimately, ideally, we want to help our staff. It's also going to have the financial side of it, right? This was a financial study. So if we improve our bottom line by keeping our workers at work, by providing them with suitable accommodations and strategies to be able to actually complete their jobs successfully, then you can have a positive impact on your bottom line as well. So there's a double benefit here, right? Your staff is going to be getting the help they need to be successful in the jobs that they're performing, and you are going to be, as the employer, are going to be able to save money ultimately by providing appropriate practical accommodation. And I mean, perhaps this isn't true in every case. Some accommodations can get quite costly, but in the vast majority, we can actually have a significant impact on our bottom line. Pardon me. So we're talking about cognitive demands at work. We're going to start to talk about some of those objectivity elements here in a moment. So cognitive demands at the workplace, we're going to divide these into 2 sort of categories, cognitive resources and cognitive skills. And the reason we split them up into 2 categories is that ultimately we need cognitive resources in order to be able to execute the cognitive skills. So you need, for example, to be able to recall information, right? So you're doing, in almost every job that you do, there is some memory recall. Even somebody who works on an assembly line performing a relatively simple task shouldn't need to look at the instructions every time, right? There's a tight timeline. They have a 4-second window in which to attach this part, right? And it happens in this way. If they had to look at instructions every time, they would not have the cognitive resource that allows them to successfully meet the timelines and deadlines and things that they need to be able to be successful at that job. So even simple jobs require the cognitive resources element. And then as we get into more complex jobs, that's where the cognitive skills come into play, right? You need to be able to have good communication skills, good memory skills, good processing skills, right, in order to be able to think critically about a situation and problem solve when you're faced with a challenge. right? We also need to be able to perceive and interpret information, and this could be information on paper information or on the computer, right? You're looking up specs and information about how something goes together, is assembled, right? Or how something is built. You also need to be able to interpret that information. Sometimes we are building something that's not identical to what we see in the information we're gathering, right? So we need to be able to pull all that information together and use that cognitive resource to execute the cognitive skill. So there are low-level cognitive tasks and there are high-level cognitive tasks. And so we try and document this as part of our cognitive demands assessments to try and evaluate some of the different elements. And this sort of connects back to cognitive resources and cognitive skills, right? Low-level cognitive tasks are things that are relatively simple. You're stating facts, you're drawing in information, you're recalling information sort of verbatim, word for word, you're following a step-by-step procedure, you're solving a very basic problem, you're doing simple arithmetic, right, basic math in terms of addition or subtraction. Those are kind of low-level cognitive tasks. And so we need to know, like a lot of people who have cognitive limitations can still perform a lot of those tasks, right? When they're not in a tight timeline, when they are able to focus and they don't have a lot of distractors present, they can perform those basic steps. They have the ability to do that. But then we start to transfer to those high-level cognitive tasks, and oftentimes we see a disconnect here, that although they have memory skills, for example, they aren't able to pull that memory forwards and then understand how it applies to the current problem at hand, right? They're not able to see the transference of information so that they can be successful. So whenever we're analyzing or trying to build connections or formulating conclusions, doing more complex math problems, right, are confronted with like a conflict situation where there's lots of variables and stimuli coming in at the same time, that's where oftentimes we see the disconnect between someone's cognitive ability and the cognitive requirements of a job. So it's important when we're documenting these that we're documenting both, right? That we want to know if this is a low-level cognitive task or a high-level cognitive task, because some of your employees will be able to do one and not the other, right? So just because they don't have great memory skills doesn't mean that they can't still perform some of the low-level cognitive tasks. If the memory requirement is short, or if it can be backed up by visual or written instructions that they have access to and it's not going to limit their ability to do the job, then there may be some good opportunities for accommodation there, right? So we do need to identify the difference between the two, low-level and high-level cognitive tasks. So as we're going through and documenting our cognitive demands, we are going to compare those two things, right? So we're going to figure out whether it's a low level or a high level. Now we also need to quantify it in some way. So we know that the task is a high or a low level cognitive element. Now we need to understand how frequently does it occur, because this plays an important role as well. Someone who has to infrequently deal with cognitive skills or abilities that are complex may be able to be successful in that job because it occurs relatively infrequently. So we need to know how often it occurs as well, which sort of connects back to the physical demands assessments. It's important that we know in the physical demands assessment, for example, how frequently it occurs and to what range of motion, for example, in a movement, or to how much weight, because oftentimes an employee has a weight limitation. They can't lift more than 20 pounds, let's say. Well, we would describe 20 pounds as like a high-level physical task, right? Whereas lifting 1 and 2 pound objects is a low-level physical activity task. So we need to be able to differentiate between the two. So weight is an important reference when we're talking about physical demands. Now when we're talking about cognitive, high and low level is also an important element. Then we need to apply some sort of frequency element to it. How frequently does this occur? Which is one of the more complex elements of a cognitive demands assessment. So why do we do these? I think a cognitive demands assessment provides some serious well-being to our employees. If you do have someone who is off work from a cognitive perspective, we're able to more accurately identify what their cognitive demands are of the job, not just the physical demands, and bring those forward so that their doctor can work with them to help decide whether it's an appropriate accommodation or not. Are they able to meet the requirements of the job? Now knowing objectively what those requirements are. It enhances the company's job description by including cognitive elements. So right now, a lot of job descriptions include the physical, and job descriptions often include some basic tasks that they need to be able to work with, all Microsoft Office programs, for example, or some very specific software programs that are relevant to their job. May talk about what education and background experience they have, but it talks in very limited terms about the type of cognitive demands required. So it may say something like needs to be able to multitask, right? But our cognitive demands assessment or analysis is designed to give us more detail about the multitasking. When do they multitask? What types of things are they multitasking? How frequently are they being required to multitask? Are they truly multitasking? Is that really an essential element of the job, right? And so we need to, our cognitive demands assessment can give us more information that allows us to move forwards with being more objective in our job descriptions. Pardon me. It aids in understanding of all the job requirements, not just the physical, which I've already mentioned. And ultimately, the goal here is to improve our return to work processes. If you have anyone who is off on a cognitive limitation of any kind or is coming back with cognitive limitations from being off, then this process or this document is likely to help you improve your return to work process. It will give you more of a structure and a layout as to how you can accurately evaluate whether someone is capable of performing the job or not, right? So we want to be moving forwards towards some kinds of cognitive demands assessment. It doesn't have to be exactly the kind of ones I'm going to show you here in a few minutes, but looking at documenting cognitive demands as part of our job will become more and more paramount as going forwards. We know we're going to have more cognitive limitations. Mental health in the workplace has been a huge focus, so we know this is the direction it's going. We just need to make sure that we have objectively documented those demands. Right? And we believe so strongly in this that we're really, I may not sound excited because I've got a cold, but we're really excited today to be actually making an offer at the end of the webinar to help you move forwards with making these cognitive demands assessments. So make sure you hang on with me until the end. We do believe this is super important. We do believe this is the next step in documenting demands of a workplace, a job at your workplace. And so we're really excited to be able to make this offer today. So hang with me till the end and I will let you know what that's going to be. So when we're looking at describing a demand, in order to evaluate each cognitive demand, you need to understand the job as a whole. And I say this because documenting a cognitive demand frequency in particular is quite challenging, right? Because the cognitive demand happens in your head. It's not like a lift. I can't count it, right? It happens in my head. So I need to understand the job as a whole to understand. Then we ultimately use that information to figure out what tasks present in that job are going to require that kind of a cognitive demand, right? So ultimately, if I break the job down by task, right? So if I say, okay, they have an 8-hour shift and they spend, let's say it's like a picker packer in a warehouse, right? So they spend 4 hours of their day on the forklift. Well, what does that require? While they're on the forklift during that time, they're going to have extreme attention to detail, right? Because they need to make sure they follow all the procedures and safety procedures, that they are, shoulder checking and that there's no damage to any product and things. They also need to make sure they're picking and packing the right objects. So they need to be, following, like actually scanning and making sure that they're picking the right product off the shelves, right? So there's a lot of attention to detail there. But there will be some memory or cognition element to that, perhaps, when you talk about the safety elements of driving the vehicle, etc. But they are going to have limited reading and writing, for example, during those elements. So if you have someone who has reading and writing as a limitation, they're likely to be able to still perform those tasks, right? So just like a physical limitation, just because you have a shoulder limitation doesn't mean you can't do 80% of your job, right? Just because you have a cognitive limitation doesn't mean you can't do 80% of your job. So when I look at the job as a whole, I figure out, okay, they spend 4 hours actually physically on the forklift. They spend an hour at the beginning of their day printing and prepping all of their orders. They're on the computer during that time. So there is more procedural-based information. They need to be able to navigate through programs. They need to print the right orders. They need to organize the orders in the right way, right? So those are organizational skills. They're different elements. And then when they're on the forklift, they're just pulling the next order off the list. So it's less organizational because they've already done that in that first hour of the day. Now they're just following through on the setup that they've already created. So throughout the day, the cognitive demands will change. So if I understand that they spend an hour in the morning doing this, 4 hours doing this, they spend another, let's say, hour manually wrapping skids, and they spend an hour at the end of the day sort of doing general 5S cleanup and sweeping and whatnot, and any other last minute sort of just-in-time orders that come in, then it gives me a pretty good picture of what their day is. And I've broken it down by task, which ultimately is going to help me when I come to determining the frequency of some of the cognitive demands, because I'm going to connect the cognitive demand to the task. So I'm going to connect the fact that the organizational element occurs for approximately an hour a day, let's say, I'm using that as my reference, because they do their organizational piece in the morning, and they spend, 30 or 40 minutes out of that hour that they have actually printing, prepping, and organizing all of the paperwork that they have for the day, right? And then the rest of the day is spent following that program. So when it comes to organizational skills, that's really going to only occur at a high level in the morning. They may have some minor organizational elements later in the day when they're picking and packing. If they empty a skid, they have to take it out, etc. But it's going to be very minor, and from a complexity level, very high-end complexity in the morning, very low-end complexity throughout the day, right? So they may very easily be able to incorporate the organizational pieces in during the bulk of their day, but may have difficulty with that 1 hour in the morning, right? So we're going to connect the cognitive demand to the task ultimately, right? So we're trying to figure out and break down the job into multiple tasks and then connect the cognitive demands to that. Right, so I gave you some examples already of low-level and high-level cognitive tasks. This just sort of connects back to that. You may want to recall the following information when you're trying to evaluate or determine the complexity of the cognitive demands, because we need to evaluate both pieces, right, the frequency and the complexity. So you want to ask questions like, what types of situations might the worker frequently encounter? So think about a conflict situation, right? You have a municipality worker who is it works in the parks, right, and is out driving a lawnmower, right? They're doing park cleanups, they're picking up garbage out of the parks, they're driving a lawnmower, they may be doing some basic weeding of gardening or some trimming, right, some edge trimming. So in terms of their emotional situations or their conflict situations, what are the odds that they are going to encounter those situations in that environment? And the answer is relatively slim. You're not going to say that they aren't going to, because they're wearing a town or a city vest or shirt and riding in a town vehicle. So they may very well have some random resident come up to them and ask a question or describe a challenge that they're having or ask for assistance with something. So they may have to deal with the public as part of that because they are representing their organization, right? But ultimately, the types of situations and the complexity of those encounters is likely to be quite limited, right? They're not likely to have someone come asking high-level questions about budgets and about projects that are ongoing, right? And if they did, they can always forward them to other people. They don't have to be the person that addresses those questions because they're likely not the best person to answer the questions anyways, right? So you need to ask what types of situations. So in my example, yes, is this person likely to experience some sort of conflict? I think probably as a town person at some point in your career, yes, you do have some resident come up and expressing some sort of conflict or asking questions about a project or whatnot. The frequency of that is relatively low, and the complexity of it can be held at a quite low level, knowing that that person can forward the information on to someone else if they need to. The next question is, what are the primary duties of the worker? is it this worker's job, and I'll use my same example I just gave, is it this worker's job to address those questions? And I mean, I think from basic customer service, the answer to that question is yes. Like, you need to be polite and, speak to the residents and assure them that, that they can get the information they need by visiting this resource or, whatnot, right? But it isn't the primary duty of that worker to be interacting with residents, right? The primary duty of that worker is riding a lawnmower, right? Or is using the whippersnipper to edge, right? Or is gardening. So the primary duties of the worker lends itself to say that the complexity of this demand in their day-to-day work is going to be quite low because it isn't a primary element of what they do. Another interesting question, and that often comes as part of all of our many of our cognitive demands evaluation elements, is what's going to happen if this doesn't go well, right? If there is a situation that happens, what are the undesired consequences that might occur, right? So think about a surgeon. Attention to detail is incredibly important in their job, right? Attention to detail is incredibly important to my job as well, right? It's my job to follow up with clients, to provide high quality reports, to make sure I don't miss any details, to include all of the high level elements that you come to expect from a professional ergonomist delivering you an assessment, right? I would say that my job has a high level of attention to detail as well, but the consequence of me getting it wrong is significantly pales in comparison to the consequence of a surgeon getting it wrong, right? So we need to use that and put that in perspective as well. What happens if this person gets it wrong? If I get it wrong, if I send a report off and it's missing a piece of data, or I've run a risk assessment incorrectly, I may be telling the client the wrong information. They may be making the wrong choices perhaps, but if a surgeon makes the wrong call, they may be they literally may kill someone, right? Like that death might be the logical next result of that mistake. So the undesired consequences can be a huge element here because that does play a significant role into whether it's suitable to bring someone back or not. If the consequence is very severe, then we want to make sure that we're addressing that or documenting that as well. It's an important element of a cognitive demands assessment. So as we differentiate between those high and low level cognitive tasks, this will help us objectify our PDA, or excuse me, our CDA. When we're looking at the frequency, I think I already highlighted this as sort of started going into this in a couple slides prior, but understanding the job as a whole allows us to determine when each cognitive demand is going to be required. So I've gotten a sort of an example here that in the bottom right-hand corner, we've only got 6 tasks listed, but you could have 30 if you wanted in there. But the essential tasks or duties section of a cognitive demands assessment, I believe, is incredibly important because you can't say that, I can't objectively say that memory occurs for 30 minutes out of every hour because I don't know. I don't see that, right? So I can't objectively document it that way. So the way I need to do this is to break it down into essential tasks. So I look at the top 6, 8, 10, 12, whatever is relevant to my job, all the different task elements, and I break it down based on what percentage of their day or their shift or even their week or their month is relevant to the task. So using my municipality worker as an example, during the summer months, we're just looking at the summer months, let's assume that. Then the summer months, you're spending 4 hours per day on the lawnmower. You're spending 1 hour per day or per shift doing edging. You're spending 1 hour per shift picking up garbage from parks. You're spending 1 hour per shift driving to and from your work locations, right? So those are the kinds of things that are going to go into your essential tasks, your essential duties. And that will help me when I get down to quantifying my cognitive demands in figuring out how frequently these things are going to occur. Because I know that while mowing, there is very limited memory recall, there's very limited decision making happening, right? They need to do some safety elements, but they are essentially doing something that is relatively monotonous, going back and forth, mowing with less cognitive demands happening during that time frame versus someone who is driving to and from a work site. There's much higher cognitive demands happening because you have to take in lots of information, process it, and respond accordingly for safety purposes as well as to follow the rules of the road, right? So we have a lot different cognitive elements happening in each different task. So when we're objectively determining the demands, I've given you just a couple quick examples. So things that are going to go into your cognitive demands assessment would be something like reading. So the questions you're going to want to answer, just so you can see some of the specifics, are things like, what are they reading? So are they reading a list? Are they reading a procedure? Or are they reading a detailed report, right? And having to recall information from that. There's a very different level there of reading from a report or a blueprint or a spec of some kind than reading a list, right? Or reading a step-by-step instruction. Then we're going to ask or figure out how complex of a task it is, which connects back to the type of report or document it is that you're reading. Then you're going to ask what tasks require it. So what tasks require reading? Likely in my municipality example, there isn't a lot of reading sort of day to day throughout. They likely have to fill out some sort of inspection form before they use the equipment. So there'll be some basic reading associated with that, reading and writing. So, but it's going to be simple, right? They're not going to be a high level of cognitive element there. They're going to read a question, they're going to answer yes or no, and go down the list, right? And then what are the challenges that they may have with that reading? So what are the difficult elements? What are what do they have to do with that information that they're reading and use it? So what makes that reading challenging or not challenging? Okay. The other example I have up here is time management. So we want to know what are the primary roles of the employee. Although they have to manage, many people manage their own time, oftentimes it is dictated to some degree by upper management, right? That it should take a certain amount of time to complete a task. So they're working to meet those guidelines or those deadlines, right? Some upper management will even give them a schedule for their day, right? Let them know exactly what they need to be doing when. And then you think about an assembly line worker, they have no time management requirements. I mean, they do. They need to complete their task within the time that's allotted, but they have 25 seconds to do whatever they need to do before their part's going to cycle to the next workstation. So they need to meet a goal, right? They have a deadline pressure, but they don't actually manage their own time, right? Somebody else, in this case a conveyor, actually manages their time. Then we look at how must the worker divide or manage their time. Do they get dedicated chunks of time to work on something? Are they in frequent meetings or working on multiple things at a time, right? That's going to increase the complexity of the time management skills, right? And and then you, from an accommodation perspective, you start to look at, can you delegate some tasks to reduce the frequency of focusing on time management? So can you pull some tasks out, or can you rearrange their schedule to help them figure out how they can time manage more simply, right? Make it a little bit easier. So these are the kinds of information that you're going to want to document in your cognitive demands assessment. Just a couple quick examples. In our cognitive demands assessment, this is ultimately how we document, or what it would look like as we document the cognitive demands of a job. So I've just chosen one at random out of one of the documents we've done, but you can see I've chosen performance of multiple tasks. So this person has multiple tasks involved. And then the first column sort of references to some degree the complexity ultimately. So you can see at the very top it talks about not responsible for multiple tasks, therefore it's not present, right? Then the next one is kind of a low level. They have some responsibility, but they have very clear guidelines and cue as to when to perform each task. So that's a low level cognitive element, right? That they have to do multiple tasks, but somebody or something is pretty clearly telling them when they need to move on to the next task. Then we have sort of the next level. They have multiple tasks. They get some time management skill and judgment to determine priorities, but there is some still guidance associated with that. And then you have your very highest level. They're constantly responsible for multiple tasks. They must exercise high degree of judgment to determine when to attend each task, right? So they may be pulled off, for example, they're being pulled off one task to get to another task because they've decided that it requires higher priority, right? So that sort of is an example of how we use that information, right? That's where your level of complexity comes into play. those ones are standard. Every document that we create that talks about performance of multiple tasks, those 4 categories read essentially the same, unless we customize it for a specific job. They read essentially the same. The section on the right is where we get into some of the quantification. And it's interesting because you don't actually see any numbers present in there anywhere, but we are going to connect that back to those basic job tasks that we talked about earlier, right? So you have essential duties or tasks of the job, numbers 1 through 6. This is going to reference the elements that are present. So if you were going to figure out when this employee performs these tasks, you could look at it occurs during tasks 1, 6, and 8. And you could even add that in as another element if you would like, right? More as a task-based cognitive demands assessment. So examples of this is the kind of language that we would use when we're writing these, right? So they manage multiple concurrent projects, varying levels of urgency and complexity. So there are some larger or long-term projects that have multiple steps. So they have to start with research, then they have to order the piece of equipment they need. They have to coordinate external companies, etc. Right? It takes several weeks. And at the same time, they're also planning to perform some specific maintenance. This was actually at a hospital, so they had some specific maintenance on equipment that they were doing. So they needed to coordinate when they would be able to do those repairs, find the specific time in that room when it was going to be available, etc. And so they have these small projects mixed in with the large projects, and all have sort of deadlines and plans and strategies, but they have to coordinate that. So you can see, hopefully you can see from that description, this would, if you think, I should have maybe given you the essential duty as element as an example as well to see how it connects back. But if you read the essential duties of this job, if I'd given you both pieces, some of the essential duties would be, for example, to manage large projects, large repair projects, for example, right? And they spend, let's say, approximately an hour a day working on that. And in that time, they'd be doing their research, making their calls to various vendors, they'd be ordering the product, etc. Right? So about an hour a day they spend managing their long-term projects. They have anywhere between 6 and 12 small projects to complete, small repair projects to complete in any given day, and that they spend 5 to 8 hours of their day performing those repair tasks. Right, so they've sort of the examples of how it will be broken down. So we can start to look at this and say, okay, maybe about an hour a day they deal with these large projects, but they do have all these small projects going on simultaneously. And so in that case, they probably spend approximately 3 to 4 hours a day managing those elements, right? So we connect, the language that's used in this description section is connecting back to those tasks that we have referenced at the beginning. Hopefully that makes sense, and you can start to see the kind of language that we would use to try and be more objective in our documentation. So this is where we get the frequency element and the sort of the qualitative description of when it occurs, what tasks require this, and then we get the complexity element in that sort of initial checkbox section. Just want to pause for a second there because I know that's the sort of the part of this webinar that was really the most unique element today, and I want to just give an opportunity for anybody who has any questions to ask them at this time. So if you have a question, please go ahead and ask away, and we will field those as they come in. So I'll just give another moment here to address those. Okay, I haven't seen any coming in yet. If they do come in, that's fine. Just shoot me just keep shooting those questions over, and I'll make sure I address them. But at least in the essence of staying on track time-wise, I'll keep going. So ultimately, now that we start objectively documenting these demands, we use that to effectively address the return to work element. Sorry, a question did come in. It asks the question, are there generally accepted and definition of scales of cognitive demands? That's a good question, and a complex one, to be honest. There are not any standardized scales or references that are used to evaluate these cognitive demands, which is part of the reason that it's been so challenging for employers to move forwards in the right direction and feel like they're being objective with their documentation. The best model coming out of Canada at the moment still continues to be the City of Toronto's Cognitive Demands Assessment, and if you search that online, you should be able to find a copy of it that you could download and refer to, but it looks very similar to the content that we are using because that is at the moment the gold standard. So we would actually pull that information from there, they did some extensive work to figure out how to properly sort of split out the cognitive complexity element. So what goes into each of those 4 categories, because every demand has 4 checkboxes, one that basically doesn't exist, one is low level, one is moderate, and one is high. And to describe the low, moderate, and high levels, they did put a lot of energy and effort into getting that part right. So the City of Toronto is the one that has been sort of the gold standard up until this point. And Pro-Ergonomics actually uses a modified version of that we've made some adjustments on our own that we believe work better for our clients in the kind of work that they are doing, sort of general day-to-day. But that is up until now has been the gold standard. So if you're looking for sort of a baseline, I would start with that one for sure. Another question that came in is, would this be part of a PDA or a PDD, or, sorry, my question's gone. Would this be part of a PDD, or would this be separate assessment entirely? And that is entirely up to you. It can be both. Right now, we've been doing a lot of combination ones. So ultimately, a PDA and we call them a PDA and a CDA, a physical demands assessment, a cognitive demands assessment, when they come together, are created and called a job demands assessment, right? So a job demands assessment typically includes both. But ultimately, you can do them separately. And actually, the example that I gave you there, the one where I actually showed you an example of what we'd written and how we'd completed it, that one was done totally independently. That was for a return to work process, and they did not have any physical limitations. This employee only had cognitive limitations. So the employer chose to just complete a cognitive demands assessment and not address the physical demands at all, because that wasn't the issue associated with this person's return to work. So that is entirely up to you. It can be done individually. They can also be done in combination. If you're going to have an outside company like ourselves assist you with these, it's often less expensive to have them done together, just because I'm already on site and I'm evaluating the demands anyways. So adding in a cognitive element can often be, let's just save you a little bit of money. It's not hugely different, but it can save you a little bit of money and travel time and whatnot. But if you're doing them internally, there's no reason that they couldn't be 2 completely separate documents. So I guess the message is, if you already have PDAs, don't go and reinvent the wheel, right? If you want to start doing CDAs as well, then I would do them, and I would do them separately, because you already have your physical demands assessments in place, right? There's no point in starting over again on those. But if you don't have either, then I would consider doing them together as a unit. Okay, so back to the return to work element here. So when we're looking at using our cognitive demands assessments for return to work, pardon me, achieving successful return to work with an employee with cognitive limitations is not an easy process. And even with the cognitive demands assessments, I'm not going to pretend that it's an easy process. It's difficult. It's hard for a doctor to, you can send someone to have a physical assessment or test done to evaluate their physical abilities, right? You don't even have to take the doctor's word for it. It's not exactly the same with a cognitive demands assessment, because you can attempt to have their cognitive demands objectively documented by a medical professional, but it is still somewhat subjective, right? There isn't always, depending on what their limitation is, there isn't always great testing available to determine exactly what they can and can't do. So part of the problem with this is that the return to work piece coming from the doctor may still be subjective, right? Just like I guess the physical demand is sometimes too, right? You get a doctor's note back that has, that all they've done is ask the employee, what can you do? And the employee's answered and they filled it in accordingly. The same can be true with a cognitive assessment, right? That the doctor may simply just ask, can you do this, can you do this, can you do this, and the employee gets to respond. Ideally, we're getting more objective information from our doctors about cognitive limitations, but it depends on their comfort level, the type of doctor that they are, whether it's going to be good qualitative or quantitative information or not. But the key here on your end is that you can't control that piece, right? You can ask, the control you have is asking for it from the right medical professional, the right doctor, right? Not the GP. And what you can control is having that objectively documented on your end, so that when that information does come back, you can start to decide whether you think there is a match present with this job and this employee's abilities or not. And if not, then we can start to evaluate that moving forwards, right? So if it's not, can we accommodate them? Here's some accommodations that we can have in place. The cool thing about a cognitive demands assessment is when you start to identify, and most often this happens as return to work cases come up, but as you start to identify what the cognitive job demands are, you may also be able to develop strategies, like existing strategies that are already in place that will help someone perform this job, right? So even if a fully cognitively capable person comes in and does the job, that they require less memory because there is more instruction manuals, or there's a step-by-step sheet of instructions posted beside the computer so that you don't have to remember how to navigate through that program that you use infrequently, right? Those kinds of things can actually be created as part of an accommodation process or proactively to help anyone who is coming back to work or has any kind of cognitive limitation be able to do that job successfully. So we can use that information to our advantage. Excuse me. Before I flip to there, I have another question that's come in. Someone has asked, what are some tools that can be provided to employees with cognitive symptoms to assist them in staying at work? So that's an interesting question, because that is very unique to the individual employee, right? Everybody has every person with a cognitive limitation is going to have different abilities, different challenges that are associated with that limitation. So you're going to need to really work one-on-one with the employee to figure out what they need, because I use my concussion example. Just because two people have a concussion doesn't mean they have the similar symptoms, right? Someone may have very significant issues with the visual elements, so they have a hard time with the high levels of lighting, hard time looking at their computer screen from the illumination, and I guess constantly looking at that bright screen is really difficult for them. Some other person may have absolutely no issues with the visual element, but maybe having problems with dizzy spells and focus and attention associated with that. So it really is a very unique process of working with them one-on-one. But I think if you can come together and figure out what pieces of their job they are specifically challenged by, and then start to work with ways that you think you can make it simpler for them. So I gave you my example of you have a program, right, that your staff have to use, your picker and packer. So I use that example again. Your shipping, receiving folks, they're picking and packing product, right? And they have to access in the morning. They go in and they print off all their orders for the day. That program is going to be very specific to your company. And very specific steps need to occur in order to do that task, right? So you could have some kind of manual that is step-by-step instructions on how to get the orders that they need printed for the day, right? And there can be even almost like a flowchart diagram, right? You start here. If this occurs, you go this route. If this occurs, you go this route. And then from there, it gives you the steps and process in place. For someone who has some issues with memory, then that kind of instruction-based manual is going to be very helpful. Anxiety problems, that instruction type manual may be very helpful. You may even go so far as to include screenshots because somebody has like reading information and recalling it is difficult, but they do a much better job with the visual elements. So if they see the picture of the screen and there's a circle around the button that they need to click on, not a line of text that says click on the copy button, right, which they now have to remember what the copy button is and then go find it on the screen, it may be simpler to include screenshots, right? So there are different, depending on what their limitations is, I guess the answer to that question is depending on your limitation, that's really going to significantly impact what type of accommodation or strategy you're going to use to help them be successful. So hopefully that addresses the question that came in. So as I promised earlier in the webinar, we're pretty excited and passionate about cognitive demands assessments. We've been seeing a huge increase in requests for these. We believe it is where people are going with them. And as a result, we want to help companies start to see how they can work for them. So we are going to be sending you an email here momentarily. And the first 5 people to respond to that email offer are going to receive a 2-for-1 cognitive demands assessment. So if you want to try out a cognitive demands assessment and see how it works for you, if you are willing to pay for one, we will give you a second one for free, ultimately. So you get 2 for 1. So that might be a great option for us. Oh, if you have any questions, sorry, my screen just my screen just jumped there. But if you do have any questions, I'm open to questions now. You can add some more in there. But we are excited about that that 2-for-1 cognitive demands assessment offer. So please make sure you respond to that email if you're interested. And again, as always, thank you for attending our webinar. We hope you got something out of it today, helping you learn a little bit better how to quantify those cognitive demands at your workplace. Oh, good question. Is there a standard price for a CDA? Yes and no. We do have some sort of basic standardized pricing for it, but it does depend on the job itself. Much like a PDA, some jobs require much higher cognitive demands than others. So we do have some pricing. When you respond to my email, if you're interested in doing a CDA, then we can talk about pricing at the time, and you can make a decision about whether it's it fits your budget right now or not, and that's fine, right? But let's talk about your specific jobs before I give you an exact price, because I don't want to mislead you high or low. So your job does play a little bit of a role in that. Okay, everybody, I've got 10:30 just now, so I am going to let you go. If you have any more questions, I'll stay on for a few more minutes, but I do appreciate your time today. And like I said, we're excited to offer that 2-for-1 cognitive demands assessment offer, so make sure you take us up on that if cognitive demands are something you think you'd like to try out at your workplace. Have a great afternoon, everybody, rest of the morning and afternoon anyways, and we will hopefully see you on our next webinar.